Hello, this is Dr. Wells with Wells Medicine. And a question I've been asked a lot recently is, do I need to have sedation for a stellate ganglion block? So when we do the stellate ganglion block here in our office, sometimes called the dual sympathetic reset, because we do use two separate injections on each side of the stellate ganglion. For those, we usually let patients drive home that same day and eat until just a few hours before the procedure because we don't usually need any sedation for those injections. And the entirety of the stellate ganglion block takes about 5 minutes. So the longest part of the whole procedure is using the ultrasound to find the correct locations and to identify the anatomical structures that we're looking for to tell us exactly where to go. And that is a little uncomfortable with the ultrasound gel and the goop kind of running along the surface of your neck. But that is predominantly what most people feel. And then the injections consist of two numbing medications right under the skin, with some very fast acting numbing medicine, and then the thinner, longer needle to administer the stellate ganglion block itself. Most people having their first stellate ganglion block are very surprised at how fast it is, how painless it is, how they didn't need any sort of sedation at all for it. It's less than, in their words, less than getting an IV, less than having teeth cleaned, far less than having, a filling placed. Some people have had a spinal injection or a joint injection, and those they've said have been far more painful or more uncomfortable, which is perhaps why those are done under anesthetics more often. We try to make it as comfortable as possible. Patients can continue wearing their prescription glasses. They can wear sunglasses, similar again to the dentist's office, where you kind of make your world a little bit smaller and more cozy by limiting your sensory input. You can have on earbuds to kind of give yourself something else to pay attention to. Some people bring music or things to look at to kind of change their sensory input. Also similar to the dentist office, where they'll have the screen up above you. And I'm there talking and explaining things the whole time, kind of helping distract patients and kind of helping them work through their fears during the injections. Once the numbing medicine is in, really most of what people are feeling during the injection is the ultrasound jelly. Those are both very big physical presences that are distracting. Sort of like when patients are getting an IV, sometimes we'll ask them to cough, or sometimes nurses will sort of flick the hand of the patient to distract them from the discomfort of the needle poke. So having the ultrasound jelly, that's a big distraction physically from any sensations they might have from the needle poke themselves. And then we're more than happy for patients to bring family members. We scoot the chair up. They're allowed to hold the patient's hand, talk to them as well, distract them during the procedure. And again, it really only takes about 5 minutes. Now, I have had some patients, because we're doing the procedure for trauma, for anxiety, where their trauma or anxiety was either too high, or they had trauma and anxiety around medical settings, or they're on very high doses of benzodiazepines or sedatives kind of in their normal everyday life, where they just called up and simply said, I can't do this procedure without some amount of sedation. Now, we don't offer propofol IV or sort of an IV awake general, or an IV general without breathing devices. We don't offer deep sedation for this procedure, but we can offer some lighter sedation. So Valium, in different strengths orally. Patients can take their normal benzodiazepines, Xanax, Valium, lorazepam, if they have a prescription for those already. We're happy for patients if they need a pain medicine and they're on pain medications, to take their pain medication, which can help sedate them as well and at least keep them on their normal pain medication dose. So we're willing to work with patients. But again, in general, most patients need less and less sedation. If they've had one injection, the next one they generally don't need as much sedation for, because they're just not as scared of the procedure anymore after having gone through it once and seeing how minimal it really is. I often will tell patients, if you're able to sit through a dental visit or you're able to sit through an IV, stellate ganglion is less than or easier than that. So I hope that clears up some of why we don't use sedation here. And I hope it helps allay any concerns about patients who really feel that they need some amount of sedation, and teaches a little bit more about stellate ganglion blocks.